Snoring, a potential precursor to atherosclerosis. Snoring may be more than a common bedtime nuisance. According to a study, snoring causes thickening and abnormalities in the carotid artery, a potential precursor to atherosclerosis. In this study, the intermediate thickness of the carotid arteries, which is the first sign of carotid artery disease, was measured in patients, aged 18 to 50 presenting snoring habits. Compared to non-snorers, snorers were found to have a significantly greater intermediate thickness of the carotid arteries. So, don't ignore the snore. Patients need to seek treatment as they would in sleep apnea, high blood pressure or other risk factors for cardiovascular disease. Thank you for watching. Have a great day.